Sarah Martinez had always been the quiet one in the emergency room. While other nurses commanded attention with their loud voices and quick movements, she moved through the corridors like a shadow, efficient but invisible. Her colleagues barely noticed her during their 12-hour shifts at St. Mary's Hospital. She never spoke up during meetings, never volunteered for the difficult cases, and certainly never drew attention to herself. On this particular Tuesday evening, the hospital hummed with its usual chaos. Ambulance sirens wailed in the distance. Patients groaned behind curtained beds, and the fluorescent lights flickered overhead, casting everything in a sickly yellow glow. Sarah stood at the nurse's station organizing medication charts with her head down, trying to disappear into the paperwork. "Sarah, can you handle bed 7? It's just a simple IV placement," barked Nurse Thompson, the shift supervisor. Thompson was a large woman with a commanding presence who treated Sarah like an intern, even though Sarah had been working there for 3 years. Sarah nodded without making eye contact and gathered her supplies. The other nurses whispered as she walked past. "She'll probably mess it up," one muttered. "Remember last month when she couldn't handle that cardiac arrest? She just froze." Sarah's hands trembled slightly as she heard the words, but she kept walking. They weren't entirely wrong. She had frozen. The pressure had been too much, the patient's life slipping away while she stood there, paralyzed by fear. Her supervisor, Dr. Reeves, had pulled her aside after that incident. "Sarah, you're competent with routine procedures, but in critical moments you fall apart. Maybe emergency medicine isn't your calling." Those words had echoed in her mind every day since. Maybe she didn't belong here. Maybe she was just taking up space, a liability waiting to happen. As Sarah approached bed 7, she saw a young man in his 20s, pale and sweating. "Just a quick IV, sir," she said softly, preparing the needle. Her hands were steady now, doing what she knew how to do. This was safe. This was routine. The patient barely acknowledged her as she inserted the line perfectly on the first try and taped it down. The evening wore on, and the emergency room gradually emptied. By 11 o'clock, most of the critical cases had been transferred or discharged. The night shift was settling into its usual quiet rhythm. Sarah was counting down the minutes until her shift ended at midnight. Just one more hour, and she could go home to her small apartment away from the judgmental stares and whispered comments. But then the radio crackled to life. "St. Mary's, we have a mass casualty incident. Bus accident on Highway 94. Multiple victims, ETA 7 minutes. Repeat mass casualty incident. The emergency room exploded into action. Nurses ran in every direction. Doctors shouted orders, and orderlies scrambled to clear beds and prepare equipment. Dr. Reeves stood in the center of the chaos, coordinating the response. "Thompson, you take triage. Stevens, prep trauma bay 1. Martinez." He paused, looking at Sarah with barely concealed doubt. "Just stay out of the way and help where you're told." Sarah felt her stomach drop. Even in a crisis, she was considered useless. The first ambulance screamed into the bay, and paramedics rushed a stretcher through the doors. A teenage girl, unconscious, blood soaking through her clothes. Then another stretcher, an elderly man, his leg bent at an unnatural angle, screaming in pain. Then another and another and another. The emergency room transformed into a war zone, with medical staff fighting to save lives against impossible odds. Sarah stood frozen near the supply closet, watching the controlled chaos unfold around her. She wanted to help, wanted to prove herself, but her body wouldn't move. The sounds overwhelmed her, screams and shouts and the constant beeping of monitors. Her heart pounded in her chest and her breathing became shallow. She was having a panic attack right there in the middle of the emergency room, exactly when they needed every available hand. "Sarah, grab more gauze," someone shouted, and she mechanically retrieved the supplies, her hands shaking as she handed them over. She was a robot, following orders but not really present. This was exactly what Dr. Reeves had warned about. She couldn't handle pressure. She crumbled when it mattered most. 2 more ambulances arrived, and the situation spiraled further out of control. There weren't enough doctors, weren't enough nurses, weren't enough hands to handle the volume of critically injured patients flooding through the doors. Sarah heard Dr. Reeves on the phone calling for backup from other hospitals, his voice tight with stress. Then she heard Thompson scream from the triage area. "We need help, now!" "This kid's crashing." Sarah turned to see a small boy, maybe 8 years old, his chest barely rising and falling, blood pooling beneath the stretcher. Thompson was trying to establish an airway, but her hands were full with another patient. Every other medical professional was occupied with their own critical cases. Nobody was coming to help. Sarah's feet moved before her brain caught up. She found herself standing beside the boy, staring down at his pale, innocent face. His lips were turning blue. He was dying right in front of her, and she was the only one available. This was her nightmare scenario, the exact situation where she always failed. But as she looked at that child's face, something deep inside her shifted. This wasn't about her fear anymore. This wasn't about proving herself to colleagues who doubted her. This was about a little boy who deserved to live. Sarah's training kicked in like muscle memory. She grabbed the bag valve mask and positioned it over the boy's face, creating a seal and squeezing rhythmically to force air into his lungs. His chest rose and fell with each compression. She checked his pulse, weak but present. Her mind raced through protocols she'd memorized years ago but never had to use under real pressure. "I need suction," she called out, her voice surprisingly steady. An orderly appeared with the equipment, and Sarah quickly cleared the boy's airway of blood and debris. She worked with a precision she didn't know she possessed, her hands no longer trembling, her focus laser sharp. The boy's oxygen saturation began to climb, 68, 72, 79%. "Get me an intubation kit," Sarah said to the orderly, her voice calm but authoritative. This was the procedure she'd practiced countless times on dummies but had been too afraid to attempt on real patients when it truly mattered. The kit appeared, and she opened it with steady hands. She could hear her instructor's voice from nursing school, talking her through each step. Visualize the vocal cords, insert the laryngoscope, advance the tube, inflate the cuff, confirm placement. Time seemed to slow down as Sarah positioned the laryngoscope blade and peered into the boy's throat. She could see the anatomical landmarks clearly despite the blood. With careful precision, she threaded the endotracheal tube through the vocal cords and into the trachea. She inflated the cuff, attached the bag valve mask to the tube, and squeezed. The boy's chest rose symmetrically. She placed her stethoscope on his chest and heard clear, bilateral breath sounds. The intubation was perfect. "Tubes in, someone bag him while I get IV access," Sarah instructed. And suddenly a resident appeared beside her, taking over ventilation duties. Sarah's hands moved with practiced efficiency as she found a vein in the boy's small arm and established an IV line. She hung a bag of fluids and adjusted the drip rate, then quickly assessed his other injuries. A deep laceration on his forehead, possible internal bleeding, but he was stable for now. Dr. Reeves appeared at her shoulder, his eyes wide with surprise. "Martinez, how did you—" He looked down at the boy, then at the monitor showing improving vital signs, then back at Sarah with an expression she'd never seen from him before. Respect. He needed an airway. "I established one," Sarah said simply, her attention still focused on her patient. She was checking pupil response, looking for signs of head trauma, her assessment thorough and professional. The boy's color was improving, the blue tinge fading from his lips as oxygen flooded his system. "That was textbook intubation, Doctor," Reeves said, genuine admiration in his voice. "Under extremely difficult circumstances. I didn't know you had that in you, Martinez." Sarah didn't respond. She was too busy making sure her patient stayed stable. Praise could wait. Right now, this child needed her complete attention. But the crisis wasn't over. The radio crackled again. "St. Mary's, be advised, we have more victims being extracted from the bus. 3 critical, ETA 4 minutes. The emergency room, already at capacity, would have to find room for 3 more critical patients." Dr. Reeves cursed under his breath and ran to coordinate the response. Sarah stayed with the boy, monitoring his vitals, adjusting his IV fluids, ensuring the ventilator settings were appropriate. An orderly stood by, manually bagging the patient since all the ventilators were in use. The child's parents hadn't arrived yet. Sarah wondered if they even knew their son was here, fighting for his life. The next wave of ambulances arrived, and the emergency room descended into even greater chaos. A woman in her 30s, massive head trauma, pupils fixed and dilated. A man with a piece of metal impaled through his abdomen, screaming in agony. A pregnant woman 8 months along in premature labor from the trauma. The staff was completely overwhelmed. Thompson ran past Sarah, blood on her scrubs, sweat dripping down her face. "We're drowning here. We need more hands." She didn't even look at Sarah, didn't acknowledge what Sarah had just accomplished. She was just another body in the room, still invisible despite having just saved a child's life. But Dr. Reeves had different ideas. He strode over to Sarah, his expression grim but determined. "Martinez, I need you on the pregnant trauma patient. She's in Bay 3. We've got a potential emergency C-section situation, and I'm short-staffed. Can you handle it?" Sarah's first instinct was to say no, to defer to someone more experienced, to hide behind her fear. But then she looked down at the little boy she'd just intubated, his chest rising and falling steadily now, his color almost normal. She had done that. She had saved him when everyone else was too busy or too overwhelmed. Maybe Dr. Reeves was right about her before, but maybe that version of Sarah was gone now. "I can handle it," Sarah said, and she meant it. She gave quick instructions to the orderly about monitoring the boy, then hurried to Bay 3. The pregnant woman was on the bed, crying hysterically, her hands clutching her swollen belly, and obstetric resident was performing an ultrasound, his face tight with worry. "Fetal distress," he said quickly. "Heart rate dropping. We might need to deliver now, but all the ORs are full. We might have to do it here." Sarah felt a spike of fear. An emergency C-section in the ER, with no surgical team, no anesthesiologist, readily available, in the middle of a mass casualty event. This was beyond anything she'd ever done. But the woman looked at Sarah with desperate, terrified eyes. "Please, save my baby. Please." Sarah saw herself in those eyes, saw every moment of fear and self-doubt she'd carried for years. And she saw something else, too. She saw a mother who needed help, a baby who deserved a chance, in a situation where Sarah was one of the few people available to make a difference. "Get me a C-section kit," Sarah said to a nearby nurse. "Call anesthesia stat, but prepare for local if we can't wait, and someone page OB/GYN, tell them it's an emergency." Her voice didn't waver. Her hands didn't shake. She was becoming someone new, someone she didn't recognize but was beginning to respect. The obstetric resident looked at Sarah with uncertainty. "Are you sure about this? Have you assisted with a C-section before?" Sarah had assisted with exactly 2 cesarean deliveries during her training, both in controlled environments with full surgical teams. This was completely different. This was chaos, with a mother bleeding internally from the crash, a baby in distress, and no guarantee that help would arrive in time. "I've done it twice," Sarah admitted. "But we don't have a choice. That baby's heart rate is dropping. We wait, and we lose them both." The resident nodded, recognizing the truth in her words. Together they began preparing the patient, explaining the situation to the terrified mother as gently as they could while working at breakneck speed. An anesthesiologist rushed in, assessed the situation in seconds, and began administering medication. "I can give you 15 minutes, maybe 20, he said. "After that, I'm needed in Trauma Bay 1 for a thoracic surgery. You'll have to be fast." Sarah nodded. Fast she could do. It was the precision under pressure that had always been her downfall. The resident made the first incision, and Sarah assisted, holding retractors, maintaining visibility, controlling bleeding with suction and gauze. Her hands moved with confidence she didn't know she possessed. The resident cut deeper, through layers of tissue and muscle, until the uterus was visible. The baby's heart rate continued to drop on the monitor. They were running out of time. "Uterine incision," the resident announced, making a careful cut. Amniotic fluid gushed out, and Sarah could see the baby's dark hair. The resident reached in, gently guiding the infant's head through the opening. "Shoulders are stuck," he muttered, his voice tight with stress. The baby wouldn't come free. Sarah had read about this complication. Shoulder dystocia during C-sections was rare but dangerous. Every second the baby remained trapped increased the risk of permanent injury or death. The resident tried again to deliver the shoulders, but they wouldn't budge. He was beginning to panic, his movements becoming jerky and uncertain. "Let me try," Sarah said quietly. She positioned her hands differently, remembering a technique she'd read about in an obstetric emergency manual. She applied gentle but firm pressure at a specific angle, rotating the baby's body slightly while the resident pulled. Suddenly, the shoulders released and the baby slid free into the resident's waiting hands. The infant was gray and lifeless, not breathing, the umbilical cord wrapped tightly around its neck twice. Sarah grabbed a clamp and scissors, quickly cutting the cord, then took the baby to the warming table. She began resuscitation, rubbing the tiny back vigorously, clearing the airway, providing positive pressure ventilation with the smallest mask she'd ever used. 15 seconds passed. 30 seconds. The baby remained gray and unresponsive. Sarah continued compressions and ventilation, refusing to give up. She could hear the mother crying behind her, could feel the tension in the room as everyone waited for the sound they desperately needed to hear. 45 seconds. Sarah adjusted her technique, ensuring the airway was properly positioned, increasing the ventilation pressure slightly. And then, like a miracle, the baby gasped. Then gasped again, then let out a weak, pitiful cry that was the most beautiful sound Sarah had ever heard. The infant's color began to change from gray to pink, starting at the core and spreading outward. "We have respiratory effort," Sarah called out, relief flooding through her. She continued supporting the baby's breathing until it was clear the infant could maintain adequate oxygenation independently. The cry grew stronger, more insistent. This baby was going to survive. Behind her, the resident was closing the mother's incision, working quickly to stop the bleeding and repair the damage from both the surgery and the crash injuries. Sarah wrapped the baby in warm blankets and brought the tiny bundle to the mother, who sobbed with joy and relief as she touched her child's face for the first time. "You saved us," the mother whispered, tears streaming down her face. "You saved my baby." Sarah felt emotion welling up inside her but pushed it down. There were still patients who needed help, still chaos to navigate. She could process everything later. Dr. Reeves appeared in the doorway, surveying the scene. The successfully delivered baby, the stable mother, Sarah standing there with blood on her scrubs and exhaustion in her eyes. "Martinez, I need you in Trauma Bay 2. Now. We have a multi-system trauma patient and I'm out of experienced nurses." Sarah handed the baby to a pediatric nurse who had just arrived, gave quick report on the delivery and resuscitation, and followed Dr. Reeves. She didn't hesitate, didn't question, didn't feel the paralyzing fear that had defined her for so long. Something fundamental had shifted inside her during this impossible night. Trauma Bay 2 contained a young woman, early 20s, unconscious, with obvious signs of severe injuries, chest trauma, possible spine injury, significant blood loss. Dr. Reeves was preparing to insert a chest tube to treat a collapsed lung. "I need you to manage her airway and monitor vitals while I work," he instructed Sarah. Sarah positioned herself at the head of the bed, assessed the patient's breathing, and determined she needed immediate intubation. Without waiting for permission, she gathered the equipment and performed the procedure, her third intubation of the night. This one was even more difficult than the boys had been, with facial swelling and blood in the airway. But Sarah maneuvered around the obstacles with steady hands and clear thinking. "Tubes in, good placement," she reported. Dr. Reeves glanced up at her, then back to his work, a small smile playing at the corners of his mouth. He didn't need to say anything. They both knew she'd just proven something important, not just to him, but to herself. The night continued in a blur of activity. Sarah moved from patient to patient, doing procedures she'd never attempted before, making split-second decisions that would have paralyzed her just hours earlier. She started central lines, managed ventilators, coordinated with specialists, and somehow kept track of multiple critical patients simultaneously. She was everywhere at once, a steady presence in the storm of chaos. Other staff members began to notice. Thompson stopped her in the hallway around 3 in the morning. "Martinez, what happened to you tonight? You're like a completely different person." Sarah didn't know how to answer. She wasn't different. She was just finally the nurse she'd always had the potential to be, the one buried under years of fear and self-doubt. By 4 in the morning, the emergency room finally began to stabilize. The most critical patients had been treated and transferred to intensive care units or the operating room. The walking wounded had been bandaged and sent home. The dead had been respectfully covered and moved to the morgue. The exhausted staff moved through their post-crisis routines like zombies, cleaning equipment, restocking supplies, documenting the night's events. Sarah sat at the nurse's station, completing her charting. Her hands ached, her feet throbbed, and her scrubs were stained with the blood of at least a dozen different patients. But she felt more alive than she had in years. Every time she closed her eyes, she saw the faces of the people she'd helped save. The little boy who was now stable in the pediatric ICU. The baby who would grow up never knowing how close to death she'd come. The young woman in Trauma Bay 2 who was already showing signs of improvement. Dr. Reeves approached her desk holding 2 cups of coffee. He set one down in front of Sarah and took a sip from the other. 23 victims from that bus crash, he said quietly. We lost 3. 20 made it because of the work done in this ER tonight. 5 of them made it specifically because of you, Martinez. Sarah looked up at him, uncertain how to respond. I was just doing my job, she said finally. Dr. Reeves shook his head. No, you went way beyond your job. You performed procedures that most nurses with twice your experience wouldn't attempt. You made decisions that saved lives. You stepped up when we needed you most. I thought you said emergency medicine wasn't my calling, Sarah reminded him. Not accusatory, but simply stating a fact. Dr. Reeves had the grace to look uncomfortable. I was wrong. I saw someone who froze during one bad situation and assumed that defined you. I didn't see what you were capable of when it really mattered. I'm sorry for that. Thompson joined them, looking exhausted but grudgingly impressed. Martinez, I owe you an apology too. I've been riding you hard for months, doubting every move you made. But tonight, you were the steady hand we needed. You didn't panic, didn't hesitate, just did what needed to be done. That takes real courage. Sarah felt tears prickling at the corners of her eyes but refused to let them fall. I've been afraid my whole career, she admitted quietly. Afraid of making mistakes, afraid of not being good enough, afraid of failing when it counted. Tonight, I was still afraid. But I realized something. The patients don't care about my fear. They just need help. So I gave it to them. The 3 of them sat in silence for a moment, sipping coffee, processing the trauma of the night. Around them, the emergency room was returning to its normal rhythm. A man with chest pain in Bay 4, a child with a fever in Bay 2, the endless parade of human suffering that was the daily reality of emergency medicine. Get some rest, Martinez, Dr. Reeves said finally. Your shift ended 4 hours ago. Come back tomorrow ready to do it again. Sarah nodded and gathered her things. As she walked toward the exit, other staff members stopped her to offer words of thanks and congratulations. People who had ignored her for months were now treating her like a hero, but Sarah didn't feel like a hero. She felt like someone who had finally figured out who she really was. Under all the fear and self-doubt, there had always been a competent, capable nurse waiting to emerge. It had just taken the worst night of her career to bring that person to the surface. The drive home was quiet, the streets nearly empty at this pre-dawn hour. Sarah's mind replayed the night's events in vivid detail. Every decision, every procedure, every moment where she'd had to choose between fear and action. She'd chosen action every single time, and people were alive because of it. When she finally reached her apartment, Sarah stood in the doorway for a long moment, looking at the space that had been her refuge from the world, the place where she'd hidden from her inadequacies, convinced herself she wasn't good enough, replayed every mistake and failure until they defined her. That version of Sarah felt like a stranger now. She showered, washing away the blood and sweat and exhaustion, watching the water circle the drain in shades of pink and red. She should have felt traumatized, overwhelmed by what she'd witnessed and done. But instead she felt calm, centered, like she'd finally found the thing she'd been searching for all along, a sense of purpose and competence that no amount of self-doubt could erase. Sarah set her alarm for 8 hours later, knowing she'd promised Dr. Reeves she'd return for another shift. As she lay in bed, exhaustion finally overtaking her, she thought about the little boy with the breathing tube. She'd saved his life. That was real. That mattered. Whatever happened next, she'd always have that. When the alarm jolted Sarah awake 8 hours later, her body screamed in protest. Every muscle ached. Her head throbbed. For a moment, she considered calling in sick. taking a day to recover from the physical and emotional toll of the previous night. But then she remembered Dr. Reeves's words. Come back tomorrow ready to do it again. She got dressed in clean scrubs, made coffee, and reviewed the morning news on her phone. The bus crash was the top story. Miraculous survival rate at St. Mary's Hospital, the headline read. The article praised the emergency room staff for their exceptional response to the mass casualty event. There was a quote from the hospital administrator, calling the team's work nothing short of heroic. Sarah felt strange reading the article. She was part of that team now, part of something larger than herself. For years, she'd felt like an outsider, someone who didn't quite belong in the high-stakes world of emergency medicine. But last night had changed everything. She'd proven, not to her colleagues, but to herself, that she belonged there. The drive back to the hospital felt different. Sarah noticed things she'd never paid attention to before, the way sunlight filtered through the trees, the sound of children laughing in a playground, the simple beauty of ordinary life continuing despite the tragedy and trauma happening inside hospital walls. These were the people she helped protect by doing her job well. Every successful resuscitation, every life saved meant someone got to continue experiencing these small, precious moments. When Sarah walked into the emergency room, the atmosphere was subdued. The exhausted staff from the night shift were finishing their documentation, preparing to hand off to the day shift. Dr. Reeves saw Sarah enter and waved her over. Martinez, glad you're here. I want you to round with me on the patients from last night, check on their progress. Sarah followed Dr. Reeves through the hospital, visiting the intensive care units and surgical floors where their patients from the previous night were recovering. The little boy she'd intubated was awake, breathing on his own now, the tube removed. His parents were at his bedside holding his hands, tears of gratitude streaming down their faces. When they saw Sarah, they stood and embraced her, thanking her over and over for saving their son's life. You gave us our miracle, the mother said, her voice breaking. The doctors told us you were the one who got him breathing again when everyone else was too busy. You didn't give up on him. Sarah felt the weight of their gratitude, understanding for the first time the true impact of her work. This wasn't just about medical procedures and protocols. This was about families staying intact, about futures that almost ended but didn't, about love that got another chance to grow. The baby Sarah had helped deliver was in the neonatal ICU, tiny but strong, her little chest rising and falling steadily. The mother was there too, recovered from surgery, sitting beside her daughter's incubator with wonder in her eyes. She reached out and squeezed Sarah's hand when she approached. They told me about what you did, how you stayed calm when things went wrong. My daughter has a whole life ahead of her because you knew what to do. Each patient they visited had a similar story. Lives hanging in the balance, teetering on the edge of death, pulled back because someone with the right skills and determination was there at the critical moment. Sarah had been that person 5 times in one night. 5 times she'd made the difference between life and death. The magnitude of it was overwhelming. This is why we do what we do, Dr. Reeves said as they left the last patient's room. The hours are terrible, the stress is unmanageable, and the pay could be better. But where else can you have this kind of impact? Where else does what you do in a single moment determine whether someone lives or dies? Sarah understood now. She'd spent years focusing on her failures, replaying the moments when she'd frozen or made mistakes. But one perfect night had shown her what she was truly capable of when she stopped being afraid. When they returned to the emergency room, Sarah was surprised to see several of her colleagues gathered around the nurses' station. Thompson stepped forward looking uncharacteristically emotional. Martinez, we wanted to say something. Last night we saw a side of you we didn't know existed. You weren't just competent, you were exceptional. And we're sorry for not recognizing your potential before now. Other nurses nodded in agreement, adding their own words of respect and admiration. Sarah felt her cheeks flush with embarrassment and pride. These were people whose opinions she'd valued for years, whose approval she desperately wanted. Now she had it, but she realized something surprising. She didn't need it anymore. The validation she'd been seeking had to come from within, from knowing she'd done her best and succeeded. Thank you, Sarah said simply. But I don't want last night to be a fluke. I want to be that nurse every single shift, the one who doesn't hesitate, doesn't doubt, just does what needs to be done. I need to figure out how to maintain that confidence even when there isn't a crisis pushing me forward. Dr. Reeves smiled. That's the real challenge, isn't it? Anyone can rise to the occasion once, doing it consistently shift after shift, year after year. That's what separates good nurses from great ones. But I believe you can do it, Martinez. You've already proven you have what it takes. The day shift proceeded with its normal rhythm: chest pains and broken bones, anxiety attacks and allergic reactions. Nothing as dramatic as the bus crash, but each patient deserved the same level of care and attention. Sarah moved through her assignments with newfound confidence, making decisions without second-guessing herself, trusting her training and instincts. Around mid-afternoon, a young woman came into the ER complaining of severe abdominal pain. Sarah took her history, performed an assessment, and immediately recognized the signs of an ectopic pregnancy about to rupture. She alerted Dr. Reeves, who confirmed the diagnosis and rushed the patient to surgery. Another life saved because Sarah had been alert, competent, and confident enough to trust her clinical judgment. "You're on a roll," Dr. Reeves commented later. "That could have been a disaster if you'd missed it or hesitated. But you didn't. You saw the problem and acted immediately. That's the nurse I saw last night, the one I want to see every day from now on." As Sarah's shift wound down, she reflected on everything that had changed in just 24 hours. She was still the same person, with the same training and experience. But something fundamental had shifted in how she viewed herself. The fear and self-doubt that had defined her for years hadn't disappeared completely. They were still there, whispering in the back of her mind. But now she knew they didn't have to control her. She could feel afraid and still act. She could doubt herself and still succeed. That evening, Sarah drove home through the city streets, watching people go about their lives, completely unaware of the drama that unfolded daily inside hospital walls. She thought about all the patients she'd helped during her career, even before last night's heroics. The successful IV placements that had delivered life-saving medications. The careful monitoring that had caught problems before they became crises. The compassionate care that had comforted frightened patients in their darkest moments. She'd been contributing all along, even when she didn't recognize it. The difference now was that she could see her own value clearly. She wasn't just taking up space or avoiding disaster. She was making a real difference in people's lives every single day. That knowledge filled her with a sense of purpose she'd never experienced before. When Sarah entered her apartment that evening, she looked around with fresh eyes. This was no longer a hiding place. It was simply home, a place to rest and recharge between shifts. She no longer needed to hide from the world because she no longer saw herself as inadequate or unworthy. She was a damn good nurse, and if last night had taught her anything, it was that she could handle whatever challenges came her way. Sarah made dinner, simple but satisfying, and sat on her couch thinking about the future. For years she'd been stuck in place, too afraid to take risks or pursue advancement. But now she wondered what else she might be capable of. Could she become a charge nurse? A supervisor? Could she specialize in trauma care or critical care nursing? The possibilities seemed endless now that fear wasn't holding her back. 3 months later, Sarah stood in front of the hospital board of directors, accepting an award for exceptional nursing care. The little boy she'd intubated during the bus crash was there with his parents, healthy and energetic, living proof of the difference one person could make in a critical moment. The room was filled with colleagues, patients, and families whose lives had been touched by Sarah's work. "When I joined St. Mary's 3 years ago, I was terrified," Sarah said in her acceptance speech. "I doubted every decision, questioned every action, and convinced myself I wasn't good enough to be an emergency room nurse. That night 3 months ago, when the bus crash brought chaos to our doors, I could have retreated into that fear. Instead, I stepped forward. Not because I suddenly became brave, but because I realized that fear doesn't have to stop us. It can exist alongside action, alongside competence, alongside success." The audience applauded, and Sarah saw tears in the eyes of several nurses who understood exactly what she meant. How many of them struggled with the same doubts and insecurities? How many hid their capabilities behind walls of fear, never realizing what they could accomplish if they just pushed through? After the ceremony, the boy's mother approached Sarah with a wrapped package. "We wanted to give you something," she said. "Something to remind you of why your courage matters." Sarah unwrapped the package to find a framed photograph of the boy, smiling brightly, holding a sign that read, "Thank you for saving my life. Nurse Sarah." Sarah felt tears streaming down her face as she looked at the photo. This was why she'd become a nurse in the first place, before fear and doubt had taken root. To help people, to make a difference, to be there in someone's darkest moment and bring them back to the light. She'd lost sight of that purpose for a while, but she'd found it again when it mattered most. Dr. Reeves approached as the crowd dispersed. "Martinez, I have a proposal for you. We're starting a new trauma certification program, training nurses in advanced emergency procedures. I'd like you to be part of the first cohort and eventually help train other nurses. What do you say?" Sarah didn't hesitate. Yes, absolutely yes. A year ago, she would have declined, convinced she wasn't qualified or capable. But that version of Sarah was gone, replaced by someone who knew her own worth and wasn't afraid to embrace new challenges. The months that followed were intense. Sarah completed her trauma certification at the top of her class, mastering advanced procedures and emergency protocols. She started mentoring newer nurses, sharing not just technical skills but the mental approach that had transformed her own practice. She taught them that fear was normal, that doubt was natural, but that neither had to prevent them from being excellent nurses. One evening, Sarah was supervising a new nurse during her first major trauma case. The young woman was shaking, her hands trembling as she tried to start an IV on a critical patient. Sarah saw herself in those frightened eyes, remembered what it felt like to be paralyzed by the fear of making a mistake. "You know what to do," Sarah said calmly. "You've practiced this 100 times. The only difference is the stakes are real now. But you're ready. I believe in you, and more importantly, this patient needs you to believe in yourself." The young nurse took a deep breath, steadied her hands, and successfully placed the IV. She looked up at Sarah with gratitude and relief. "I was about to fall apart," she admitted. "But you believed in me when I didn't believe in myself." Sarah smiled. "Someone did the same for me once. Not with words, but by giving me the space to prove what I was capable of. Now I'm passing that forward to you." Years passed and Sarah's reputation grew. She became known as one of the best trauma nurses in the region, someone who could handle any emergency with calm competence. But more than that, she became known as a teacher and mentor who transformed struggling nurses into confident professionals. She remembered what it felt like to doubt yourself, and she used that understanding to help others overcome their own fears. The little boy from the bus crash grew up, visited the hospital every year on the anniversary of the accident to thank the staff who'd saved his life. He always sought out Sarah specifically, bringing cards and pictures showing how he was growing and thriving. "I'm going to be a doctor," he told Sarah when he was in high school. "Because of what you did for me. I want to help people the way you helped me." Sarah felt a profound sense of fulfillment hearing those words. The impact of that one night had rippled outward in ways she never could have imagined. She'd saved a life, and that life would go on to save other lives. The chain of compassion and competence continued, generation after generation, because someone had chosen courage over fear in a critical moment. Eventually, Sarah was promoted to nursing supervisor, overseeing the entire emergency department. She used her position to create a culture where nurses felt supported, not judged, where mistakes were learning opportunities rather than sources of shame. She remembered how destructive doubt and fear could be, and she worked to create an environment where people could grow past those limitations. On the 10-year anniversary of the bus crash, the hospital held a special commemoration. Many of the survivors came back to share their stories of recovery and resilience. Sarah listened to their testimonies, hearing how that one terrible night had changed trajectories, brought families closer, and inspired people to live more fully. The young woman whose baby Sarah had helped deliver was there, now with 3 children. The infant from that night was a healthy, vibrant 10-year-old, dancing around the room without a care in the world. "She exists because you existed in that moment," the mother told Sarah. "Because you were exactly where you needed to be, doing exactly what you were meant to do." As Sarah drove home that evening, she thought about the journey she'd taken over the past decade. From a fearful, doubting nurse who hid in the shadows to a confident leader who inspired others to reach their potential. The transformation hadn't happened all at once. It had been a gradual process of choosing courage repeatedly, day after day, until it became her natural response rather than the exception. The fear never completely disappeared. Even now, with years of experience and countless successful cases behind her, Sarah still felt that flutter of anxiety when a critical patient arrived. But she'd learned that fear and competence could coexist. She could feel afraid and still perform flawlessly. She could doubt herself and still make the right decisions. The fear no longer controlled her because she'd proven to herself over and over that she was capable of handling whatever challenges came her way. That night, as Sarah prepared for bed, she looked at the framed photograph on her nightstand. The little boy from the bus crash, the one who'd started it all, smiling brightly with his thank you sign. She'd kept that photo displayed for 10 years as a reminder of why her courage mattered, why pushing through fear was worth it, why being present in critical moments could change everything. Sarah turned off the light and closed her eyes, ready for whatever tomorrow would bring. She'd learned the most important lesson of her career that night 10 years ago. Not that she needed to be fearless, but that she needed to act despite her fear. That single shift had shown her who she truly was beneath all the doubt and insecurity. And every day since, she'd worked to be that person. The nurse who showed up, stepped forward, and made the difference when it mattered most. They had thought she would crumble under pressure, but instead, she had become their last hope, and in doing so, she had finally become herself.